Artificial Intelligence Doctor, www.abcpharma.net/English. User question: what are the predictive factors for early versus late symptom development in patients age 70 and older with LBBB who have undergone atrial flutter ablation and received a single-chamber pacing leadless pacemaker? Claude AI answer: this is an excellent and complex question that touches on several important aspects of cardiac electrophysiology and pacing. To address this comprehensively, we need to consider multiple factors that could influence symptom development in this specific patient population. Predictive factors for symptom development in elderly LBBB patients with atrial flutter ablation and leadless pacing. Patient-specific factors. 1. Age-related changes in cardiac structure and function. 2. Comorbidities, e.g. hypertension, diabetes, kidney disease. 3. Baseline left ventricular ejection fraction, LVEF. 4. Duration and severity of LBBB prior to pacemaker implantation. 5. Success and completeness of atrial flutter ablation. Pacing-related factors. 1. Percentage of right ventricular pacing. 2. Pacing site, apical versus septal positioning of the leadless pacemaker. 3. Presence of underlying sinus node dysfunction. 4. Programming of the pacemaker, rate response settings, lower rate limit. Electrophysiological factors. 1. Residual slow pathway conduction post-ablation. 2. Development of other atrial arrhythmias, e.g. atrial fibrillation. 3. Progression of conduction system disease. Hemodynamic factors. 1. Degree of interventricular and intraventricular dysynchrony. 2. Development or worsening of mitral regurgitation. 3. Right ventricular function and pulmonary pressures. Biomarkers and imaging predictors. 1. Baseline and trending levels of NT-proBNP. 2. Echocardiographic parameters, e.g. left atrial size, LV dimensions, tissue Doppler indices. 3. Cardiac MRI findings, e.g. myocardial fibrosis, ventricular geometry. Lifestyle and environmental factors. 1. Medication adherence. 2. Dietary sodium intake. 3. Physical activity levels. 4. Psychosocial factors, e.g. depression, social support. Early symptom development may be associated with a combination of these factors, particularly more severe baseline LV dysfunction, higher percentage of RV pacing, unfavorable pacing site, and persistence of dysynchrony. Late symptom development might be seen in patients with better baseline cardiac function, lower pacing burden, and more favorable pacing site. Regular monitoring of these factors could help in early identification of patients at risk for symptom development and guide timely interventions.